This video will review all the information you need to know when feeding kittens in our nursery. During feeding shifts, volunteers will utilize a feeding station to care for kittens. Each station is equipped with a scale to weigh your kittens. Each litter we care for also has a bin of items that are used while caring for them. A bin will contain a smock, a swaddle blanket, a pen, and a bottle if the kittens are still drinking milk. When feeding kittens, volunteers will weigh his or her kitten before and after feeding and will notate the weight on the kitten's appropriate chart to ensure kittens are being fed the proper amount to thrive. Volunteers will also look the kitten over for any signs of illness. After feeding the litter, volunteers will return the kennel to a clean environment. Bottle kittens require feeding every 2 to 4 hours depending on their age. Bottle kittens are fed KMR formula, which will be ready in the nursery refrigerator. With clean hands, start by making sure your feeding station is cleaned and sanitized. Collect all clean items from the kitchen and place them on your station. Put on gloves and retrieve the items you need from the appropriate bin, as well as the feeding charts from your litter's suite. You will then fill your bottle and place it in a mug of hot water until the formula is warm against the inside of your wrist, about 45 to 60 seconds. Kittens that are being bottle fed cannot poop and pee on their own. This is a survival mechanism in nature so that predators cannot smell the kittens while mom is away. Usually the mother takes care of this by grooming the kittens, but with orphan kittens we must stimulate them to allow them to eliminate. To do this, hold the kitten with one hand and with the other hand gently rub the lower abdomen and genital area with a light amount of pressure in a circular motion with a stimulation towel. Quite a bit of waste can come out of the kittens, so it's a good idea to do this over the trash can. It's usual for kittens to urinate each time they are stimulated, and kittens should have a bowel movement at least once a day. If a kitten has not had a bowel movement in over 24 hours, make a note on their feeding chart. If it has been 36 hours since the kitten's last bowel movement, alert staff so that they can write a note on the medical board. Once your kitten is done going potty, throw away the towels and weigh your kitten. After you have weighed your kitten, use the reference on the feeding station to determine how much the kitten should eat. You will track everything on the kitten's feeding chart so volunteers and staff can ensure the kitten is thriving or give them medical attention if needed. If the kitten's start weight is lower than their previous start weight, circle it on the feeding chart. If a kitten's weight has dropped for 3 feedings, alert staff. When bottle feeding or syringe feeding, you must make sure that the kitten is upright or on its belly. Never feed a kitten on its back. It is very easy for a kitten to aspirate or take fluid into their lungs. This can cause pneumonia, which can be fatal. Now that the kitten is ready to eat, place the swaddle blanket on the tabletop for a soft surface for the kitten to drink from. Place the nipple directly into the kitten's mouth, make sure the kitten's head is tilted upwards, and hold the bottle at a 45-degree angle with the nipple downward so that as the kitten suckles, they get formula and no pockets of air. Do not squeeze the bottle as the kitten will regulate their own bottle flow. You can gently hold the kitten's head in position by placing your fingers on either side of their head, like a headband. You will be able to tell when a kitten latches, as you will feel a slight tug, bubbles will appear in the bottle, and the kitten's ears will wiggle. Sometimes, a kitten will comfort nurse, which means they will suckle on the bottle but will not drink. If a kitten does this, pull the bottle away slightly to encourage them to drink. Once the kitten lets go of the nipple, weigh them once more. Depending on their weight gain, the kitten has either gotten enough or you may need to attempt to feed them again. If a kitten is not latching, check the nipple for blockages and make sure the formula is still warm. If you are still having problems after this, please check with a staff member. If a bottle kitten just will not eat and is dropping weight, a nursery caregiver may decide to tube feed the kitten. Tube feeding is done by staff only, and we request volunteers do not attempt to tube feed. After the kitten is done, clean their face with a napkin or wet wipe. Leaving dried milk on a kitten can cause skin infections. Make sure the kitten is dry before placing them back into their suite, as being wet can lower their body temperature. Bottle babies cannot regulate their temperature, so it's important to feed them and get them back into their apartments as quickly as possible so they don't get chilled. If you suspect a kitten is chilled, please do not attempt to feed them and notify a nursery caregiver immediately. Sometimes kittens have a hard time grasping these new ways of eating. The nipple on a bottle is very different from what mama has, so you will have to give a lot of patience with bottle feeding. Some kittens get it right away while others are fussy and want nothing to do with it. With encouragement, kittens will usually get used to this new way of eating and become bottle masters. Because of this, do not change the nipple unless it has fallen in a contaminated area. If a kitten that used to drink really well suddenly doesn't, notify a staff member, as this is often a sign of illness. Once kittens reach around 4 weeks of age, their first set of teeth begin to show, meaning it's time to start the weaning process. When a kitten starts to wean, they are introduced to a wet food slurry we call gruel. Gruel is wet food that we blend with water to make the consistency similar to that of a smoothie or milkshake. This allows the kittens to eat the food more easily and also aids in syringe feeding kittens that refuse to eat. Once a kitten is weaned, they are more self-sustainable and can be fed less often than the bottle babies. Once a kitten starts this weaning process, you will be offering them gruel. Gruel is a nutritious blend of canned food and water. Kittens that are weaning should be checked on and fed approximately every 4 to 6 hours, depending on their age. During the first week or so, kittens will eat both gruel and bottle while making the transition. Weaning takes time, and some kittens catch on faster than others, so remember to be patient. Always check the feeding reference on the station to ensure that you are feeding your kitten enough food at each feeding. Kittens who are eating gruel do not need to be stimulated before being fed. For each kitten in the litter, you will be offering 1 to 2 heaping spoonfuls of gruel. When you first introduce a kitten to gruel, it is best to place a little bit of gruel on a gloved finger and offer it to the kitten. Hand-raised kittens associate hands with food, so this method encourages the kittens to eat. Guide the kitten's face to the gruel tray. Do not shove a kitten's face into the gruel tray, as this can cause aspiration of the gruel. Some kittens prefer to eat gruel from a spoon. You can gently open the kitten's mouth and place some gruel in their mouth with your finger or spoon. Kittens sometimes just need to taste it and then will start eating. If a kitten does not get enough gruel from that feeding and he is still weaning, supplement with the bottle to ensure that they are gaining enough. For older kittens who are fully weaned off the bottle and refuse to eat, syringe feeding may be necessary. Pay close attention to their feeding charts and circle their weight if it is lower than the previous start weight. If a kitten has dropped weight since their last start weight for 3 consecutive feedings, notify a staff member. Syringe feeding can be performed by volunteers with the permission and guidance of a staff member. While syringe feeding can be difficult for both the kitten and the volunteer, it is necessary to ensure the kitten is getting the adequate nutrients and nourishment. Usually when kittens refuse to eat, it is because they are ill, but that is when they need food the most. To syringe feed a kitten, check the reference on the feeding station to see how much the kitten needs to gain for that feeding. Then, draw up some gruel in a syringe and gently open the kitten's mouth and advance some gruel into their mouth. Repeat this process until the kitten has gained enough for that feeding by checking the weight on the scale. Syringing kittens can be a messy process, so make sure that the kitten's face is clean before placing them back into their suite. Leaving dried gruel on their fur can cause skin infections. Always make sure to leave the kitten in a clean environment by following the cleaning protocols from the first video.